Please welcome Dr. Mike Mitchell Katz, Director of Los Angeles County Department of Health Services.
Good afternoon, everyone. I'm very proud to be in a crowd of such great doers. When I first became the director of the Los Angeles Department of Health Services, as part of my introduction, I toured LAC-USC, which is our big hospital, known in the LA vernacular as Big County. And I met with the doctors, I met with the nurses and the administrators, the patients. We walked up and down the halls, and I said to them, what are the big challenges that you face? And what they said to me was, we have all of these homeless patients who have been in our medical wards for weeks and months on end. And they're no longer acutely ill, but we can't discharge them because they don't have a home. And I thought about it, and I said, well, having recently come from San Francisco, I said, well, what about supportive housing? And they said, county can't afford it. And I said, really? I don't understand how that works. The county can afford to keep people in the hospital at a cost of $3,800 a day, but you can't afford... Thank you. You can't afford $1,300 a month for supportive housing. I suggested, and I don't think they thought it was funny, I suggested, why don't you put them up at the Omni, where they put me up when they were trying to recruit me. It's a government rate's $140 a night. We'll pocket the $2,000, that we save, and we'll be able to do it, right? So I had learned in San Francisco and working with Mark Trotz, my colleague, that we were able to move money from hospitals, from emergency room costs, from institutionalization, from incarceration. We were able to take those dollars and put them into housing. We went from 0 to 1,500 units over a 13-year period in San Francisco. And each time we had a success, we didn't write a report, we took the money and we put it into the next housing project. And I think that's the model that we want to do here. Thank you. So in LA, we are now working to do the same thing. We have created so far in the last year and a half 380 units. I'm going to show you a few of them. This is the Star Apartments, which were created with this phenomenal modular type building that came in with Skid Row housing. We're also going to have a clinic on that first floor where you can see the storefront. This is Parkview Place, which is a senior complex that's going to have 20 units for people with high risk for becoming homeless or are homeless at the time. The Alexandria, how about this for an LA story, right? Once Charlie Chaplin and Humphrey Bogart lived there. Well, how about some people who were recently homeless living there, right? That's what we're going to have 90 units in the Alexandria. And then a neighborhood stabilization project, which is going to have a total of 56 units. Overall, we're going to be at 1,000 of these units by the end of the year. And I'm committed, as is the broader LA community, and you heard already through Becky for some of the great leaders in Los Angeles in philanthropy, in business. We're going for 15,000 units. That's what we think it's going to take in Los Angeles County. So I want to leave you for your communities thinking about two trends that really can help us: the ACA and health reform and value-based purchasing. So the ACA makes it possible for us to have a new funding source for people who were once uninsured. So previously the counties, Los Angeles or San Francisco, were paying the full expenses for people who were uninsured. Now we have, through the ACA, a method of providing health care. We need to drive that method to be able to use the resources for housing. And then we need to marry that with the approach of value-based purchasing, because all of us who've been in the field, whether as doctors in a clinic where I've actually seen how when my patients get in housing. Their emergency room drops, the use of emergency room drops, the hospitalization drops, they get jailed less, right? This is the reality of what happens. So we actually can use the money better through bundled payments, through per month capitations, anything that gets us out of the cycle of paying for hospitalization but not paying for housing. And what we all know from the work that we do is that housing is the ultimate value purchase. That's how you change the arc of people's life. Thank you so much.